Hi, my name is Ebony, and I'm working on the informed consent module for this week. I was able to pull my information from a psychologist by the name of Lisa A. Linhart, located here in the Rockville, Maryland area. She started her informed consent off with an introduction, simply stating how she will be doing everything possible to make their therapy session visits helpful and useful, but she also makes it known that she will be following all guidelines and rules that are mandated by the state of Maryland. The first portion of her informed consent speaks on her therapeutic approaches and treatment options. She talks about how therapy methods utilized are accepted by professional practices, and they are specific per client, whether child or adult. And she also offers them the option to ask questions and ask for alternative approaches. She speaks on the insurance coverage. She mentions how most sessions are covered when it involves acute and severe situations, but sometimes insurance do not cover sessions that require long treatment terms, and if it's for like less symptoms in less difficult situations. So she speaks on that and how she will discuss with the client for other possible options for coverage. She talks on confidentiality and release of information. She mentions how Maryland law recognizes that the client communication is a privilege, and that many information concerning treatment can only be released with a written consent, but there are certain situations in which the psychologist is legally required to disregard treatment confidentiality and release information on certain situations, such as any suspicion for child abuse or neglect, suspicion of harm to self, which is mentioned in the ACA Code of Ethics, where the psychologist is obligated to protecting the client at all costs. And like I said, she speaks on payment options and how delinquent accounts for more than 60 days may be referred to collection agencies per Maryland's law. She has a statement of understanding at the end of her consent form, and it reads that the client simply understands everything that the psychologist, Lisa Linhart, will be doing during their sessions, and they understand what the treatments are for. The only some things that did not stand out to me that I thought would be included in the consent: she did not mention her complete credentials. She didn't mention the schools she's attended. She did not speak in depth on like her specialties or the areas that she's used to working with, or like really her openness to diversity. But she did explain what I guess is completely necessary for the client to know.